from KUSI, this is Good Business San Diego. Sponsored by Wilsey Asset Management.
Hi, I'm Roy Robertson. Welcome to Good Business San Diego, where we're talking about what matters most to you, your community, your home, your family, and your health and well-being. And the following segment is brought to you by Jackson House. More people today are seeking help for mental health concerns, numbers that increased significantly when the pandemic started 6 years ago. There are many treatment options that are available to you, but it may be challenging to find the right therapist or program. So Dr. Bruce Figuered, CEO of Jackson House, joins us again today with some guidance about finding the right professionals to support your mental health needs. So Dr. Figuered, clearly the first step is to identify that you do have the need, right? To come to that realization, it's time to get help, and then where do you turn from there? Where do you start the process?
Oh, great question, Roy. I mean, you can start in a number of different places. Sometimes people start by calling their insurance company and saying, you know, like, hey, I'm struggling with this problem and I need help. Other times, you know, people will, you know, search for organizations like Jackson House and West Coast Treatment Centers and give us a call, and we have people that are available 8 a.m. till 8 p.m. 7 days a week, and they can answer questions. They can talk to you about, you know, what it is that you're going through, or maybe a loved one is going through, and the best way to get help. Oftentimes it's not with Jackson House. Oftentimes it's, you know, just going to see a therapist or going to see a psychiatrist or talking to your primary care doctor if you're struggling with anxiety or depression. And in other instances, if the problem is more severe, you know, we have outpatient programs as well as residential treatment programs. So depending on where somebody's at any given time with their mental health problem or their addiction problem, there are treatment options available to people.
So really the first step is to make a call and to have a conversation. Walk us through the process. What happens when somebody does call Jackson House, and how do you go through that screening process, and where do you progress from there?
Sure, yeah. So we have admissions people who are on the phone and available, like I said, 8 a.m. to 8 p.m. They begin by asking questions. Well, why are you calling? What prompted you to call us? What are the things that you're going through? Is this for you or is it for a loved one? And really, like, a lot of times what I've found is that it's oftentimes the family member of somebody that makes the initial call. It could be a parent, could be a spouse. And so if we look at, you know, the numbers of people who are suffering from either, let's take an addiction problem, 66% of all families are impacted by someone who has a substance use disorder. So more people than not. So it's not uncommon. And over 50% of all families are impacted by somebody who has a mental health condition, whether it's a severe mental health condition or more mild mental health condition. So I want everybody to know at home that this is something that you don't have to keep quiet. You don't have to, you know, you don't have to protect yourself from it. It's like getting treatment for any medical condition or physical condition. You make the call and you do something about it. And oftentimes people suffer from these ailments, either a mental health problem or an addiction problem, for years and years, and they try everything in the world that they can to fix it themselves or do it themselves. But oftentimes it's just like in physics, where an object in motion stays in motion until it's affected by an external force. And so that's really what we do.
So really, for a lot of people, they just won't make that first step. They'll downplay it. They'll minimize the impact that it's actually having on their lives, even if they do recognize that, that's okay. But really, you are there for them, and that's the most important message, is that there's help available.
And so often people have the stigma, like, oh, it's a weakness of character, or it's I'm not strong enough to deal with it. But it's actually the opposite. People fight and fight and fight on their own to deal with it, and it's not until they get the help from the outside and are given the education and the actual professional services that people get better.
And one thing that you alluded to at the start of the conversation, a cost is a factor too. We got to wrap it up here, but I know that insurance coverage is available through Jackson House.
Jackson House is one of the few organizations that is in network with every commercial insurance company, as an in-network provider, and then in other counties outside of San Diego, we actually do take Medi-Cal.
Okay, terrific. Thanks, Bruce.
Thank you.
Appreciate it. The website for more information and to make that first contact is jacksonhousecares.com. We'll be right back.